Good morning, everybody. Dr. Patmos. It is April 26th. And, I commented quite a bit the other day and last week about the Dr. Bhattacharya's unilateral decision to block publication of a well done CDC study that showed that the COVID mRNA vaccine was highly effective at preventing serious disease and hospitalization and, by extension, death. And that was a well done study using a traditional methodology done by CDC and other public health experts all around the world. And yet, Dr. Bhattacharya didn't like the methodology and decided unilaterally in his power as acting director of CDC and director of NIH to simply block publication of the study, basically denying physicians and public health experts and the public from knowing how effective this vaccine is. It's a really outrageous action that he took. And I posted about it, and one of my followers talked about or mentioned that he recognized Bhattacharya was really biased way back in 2021 based on a paper that Bhattacharya had published back then. So I thought I would take another, I vaguely remember that paper, and I didn't think much of it at the time, but I went back and found the citation, reviewed the paper, and did a critical appraisal of it. And that's what's in the text below. To skip ahead, Bhattacharya's 2021 paper is a piece of junk. He's obviously doesn't have research training. He is an economist. He doesn't have an internship, residency, fellowship. He's not board certified, not board eligible, unlicensed, no medical staff privileges, no clinical experience, no real training in bench science, clinical research. He is an economist. And it really shows in this study, because the study that he published in 2021 is so incredibly fundamentally flawed. Um, and the analysis and of that is all in the text below. What exactly is wrong with his study? Well, he basically set out to try to say, which is the first one. A scientist never sets out to try to say something. They set out to try to answer a question. It's clear from this 2021 study that what Bhattacharya was trying to do was create the impression through poor research design that COVID was widespread already and mild, and almost everybody was asymptomatic, and it was no big deal and nothing to get all exercised about. That was what he was trying to say. So, how did he go about doing it? Well, he did this ridiculous study. They went and they looked at they culled people from Santa Clara County in California to be tested for COVID using Facebook ads. And what does that do? That is selection bias. You're pulling in people more likely to have been infected or have a reason to want to be tested. So right there is a fundamental lack of randomization, and it's basically a selection bias. There's a lot more wrong with the paper, but that's the key thing, and all of its errors flow from that. If you have selection bias that points you in direction to overestimating the level of asymptomatic infection, it leads to an improper conclusion. And that improper conclusion is that COVID is no worse than the flu, is actually really common and mostly mild. And heck, we don't need to worry about it. Let's just, let her rip, because it's not that big a deal. He was biased. And this research was done um, in early on in the pandemic and published in 2021. And then later on, he published his Great Barrington Declaration, which basically extended the same mindset and really became the anchor for public health policy. And that Great Barrington Declaration basically argued for an approach to COVID, which was just vaccinate the elderly and everybody else, just let them get infected. We want them infected. Let her rip. It's not that bad of an infection, and we'll just all get herd immunity, and it'll all go away. Well, we now know this, what the results were. The results of that approach were the worst performance in the world. 1.2 million Americans, over 1.2 million Americans died. Thousands of Americans continue to die every month from COVID. It's not gone. It's still here. Many variants have come out. It's become a more mild disease than it was in the beginning because there is now a background of immunity, and a lot of people did get vaccinated, and a lot of people have been infected, and there's now hybrid immunity. So it doesn't kill as many people as it did, but it still kills, and people aren't getting vaccinated. So Bhattacharya has definitely shaped our policy and our approach to COVID, and it has resulted in a catastrophe, really a genocidal level of death. 1.2 million deaths, 30 to 40% of which were completely unnecessary because people refused to be vaccinated, in part because of the misinformation they got from Dr. Bhattacharya and Dr. Malone and Dr. McCullough and others. And so now we have this really genocidal level of death. I mean, it needs to be repeated that more people died from COVID in the United States than were killed in every war we've ever been in, including the Revolutionary War. This was a mass genocide due to incompetence, negligence, bad science, and bias. And Dr. Bhattacharya is at the heart of it. And here he is, still in power. In fact, his paper in 2021 got such attention because it was useful politically. Because if you have a paper that showed that COVID was no big deal, certain politicians would seize upon that to downplay the significance of the virus and use it for their political advantage. And that's exactly what happened. And as a result, he ended up being appointed as director of NIH and now acting director of CDC. And in his power as acting director of CDC, he just blocked a really well done study that proved that the COVID vaccination really works. So this is the world we live in. We have fake scientists doing junk research who now are telling real scientists that they can't even publish their work. And they talk about censorship. I thought you should know this. This is a travesty. It's an abomination to physicians that a doctor who never even did an internship has, authority over us. And it's really an abomination and an affront to public health and to medical science. This man is in charge and now dictating public health policy and what you, as a doctor, can know about the COVID vaccine and what you're not allowed to know. This is an outrage. This is unacceptable.